Welcome to the Nature's Variety Dog and Cat Allergies Demystified webinar, the fourth in the Nature's Variety Demystified webinar series. I'm Russ Case, and the goal of this webinar is to provide pet parents with must-have information regarding their pet dogs and cats and how potential allergies may affect them, as well as what pet parents and veterinarians can do to help alleviate their symptoms. Before I introduce our presenter, Dr. Robert Silver, let's take a look at some of the background of Nature's Variety. Nature's Variety Pet Foods began in Nebraska about 10 years ago when the company began offering raw frozen diets prior to eventually offering kibble and canned foods. The company continues to expand its natural and holistic pet foods, and its goal is simple: to empower pet parents to enhance their pets' health and longevity by creating dry, canned, and raw frozen diets developed by the company's research and development team working with leading pet nutritionists. Now, let's take a look at today's agenda. First, I'll introduce today's presenter, Dr. Robert Silver. Dr. Silver will then teach us to understand exactly what an allergy is, and will explore some causes of allergies as well as some solutions. During the webinar, listeners are encouraged to submit questions for Dr. Silver, and he will answer as many as time allows at the end of the webinar. Be sure to stick around until the very end, too, because after the Q&A, one lucky webinar registrant will be selected to win a special prize provided by Nature's Variety. Now, let's meet Dr. Silver. Dr. Robert Silver is a veterinarian in Boulder, Colorado. He is a graduate of Colorado State University's College of Veterinary Medicine with a BS in Animal Science as well as a predoctoral master's degree in cardiopulmonary physiology. He lectures in both the U.S. and abroad, speaking frequently about natural medicine and treatment protocols for diseases such as cancer, diabetes, and allergies. Dr. Silver is also a confessed labaholic and loves spending time with his lab rescue Trigger. And with that, I'm going to hand things off to our resident expert. The next voice you hear will be the man himself, Dr. Robert Silver.
Thanks, Russ, for that amazing introduction. As a veterinarian who's been in small animal practice for over 30 years, I know that the single most valuable and important health benefit you can give to your beloved critters is the gift of a healthy, natural diet. That's why I've been committed to developing these webinars as an educational tool to help you provide your pets or your patients with the best nutritional tools available to create optimally healthy, four-legged friends. I'd like to offer a hearty welcome to all of the pet parents and our veterinarian friends who are online today. And for you veterinarians who are attending today, this information can help your clients better understand why food allergies are so complex and why treating them can be so frustrating and unrewarding. Hopefully this webinar will help your clients understand why the advice of a veterinarian can help them navigate the choppy waters of food allergy. So let's start first by going through an allergy checklist. Does your pet scratch at itself incessantly? Does it smell pretty bad? Is its hair falling out, or has it become more dry or coarse? Does it have chronic anal gland problems or ear infections that just don't ever seem to go away? Does it chew at its feet incessantly? And does it get hot spots or rashes? Does it scratch itself so much that it actually creates sores? You know, if you've answered yes to one or more of these questions, it's highly likely your pet has allergies. But other conditions to rule out that can cause similar severe itching and hair loss symptoms include bacterial or fungal skin infections, infestations of fleas, and other ectoparasites like Demodex, scabies, or lice. Your veterinarian can help you figure out which of the above problems, including allergies, is causing your pet's itching and skin and hair coat problems. I've listed for you the many potential symptoms of allergies on the last slide. But you know, a lot of dogs scratch themselves and shed. How many of these dogs actually have allergies? By all estimates, allergies in our pets are on the rise. It's estimated that currently approximately 10 to 15% of all pets will develop symptoms of allergies during their lifetime. This rise in allergies in our pets parallels a similar increase in allergies in people. No one is quite sure why we are seeing this, although there are a number of theories suggesting causes such as increased vaccinations, increased environmental pollution, poor quality food, and also our better ability to diagnose allergies. But no one really knows why they are on the rise. Allergies can range in severity from just scratching a little bit more or sneezing more to being so severe that the poor pet is euthanized due to its misery. Imagine how it would feel to be continuously itching all over your body all the time, and when you scratch yourself, you would scratch so hard that you create open sores. That is what we call being miserable in your own skin. Allergies are not just difficult for the allergic pet. For the pet's guardian and family, it is also really difficult. Many families are kept awake at night because of the incessant scratching. The odor of the pet can actually be nauseating and can travel throughout the house. The mess in the household from the hair falling out and the scabs and crusts that are continually being scratched off can be very difficult to keep up with. This problem list doesn't include the expensive visits to the vet, or the expense of always having to change diets in search of that elusive, perfect hypoallergenic diet, or the expense of medication or dietary supplements that may not even manage or control these terrible symptoms of allergies very well, or the expense of rug shampooing and grooming visits for your pet. It all adds up. The bad news is that allergies are rarely cured. The best case scenario is that they are well managed for the entire lifetime of your allergic pet. Sometimes these allergic pets do get better and can sometimes manage to overcome the allergy, grow out of it, so to speak. But most often, caring for a pet with allergies never stops until the pet passes away. So what are allergies anyway? The textbook definition is: allergy is a state of hypersensitivity in which exposure to a harmless substance known as an allergen induces the body's immune system to overreact. The term hypersensitivity is the more preferred term that is used by the veterinary dermatologist and is technically more accurate than the use of the common term allergy to describe these immune system reactions that cause itching and skin and hair coat problems secondary to exposure to environmental, dietary, or contact allergens. However, for the purposes of today's webinar, I will be naming inhalants, also known as environmental, food, and contact hypersensitivities as allergies. There are three main types of allergies, as I've just alluded to. One, we have the inhalant allergies that come from exposure to allergenic substances that are inhaled through the mouth and nose or are absorbed through the skin. Second type of allergy are the food allergies, which we're going to talk quite a bit about today. And they come from exposure to allergenic substances that are ingested through the mouth. It is thought that of all allergic animals, 10 to 25% of them will have food hypersensitivity, and the remaining will have inhalant and contact hypersensitivity. There are other reactions that pets can have to food that are not considered to be food allergies or hypersensitivity. These are non-immunologic reactions to the food and thus cannot be called allergies or hypersensitivities. These non-allergic skin reactions may be due to toxins in the food, or they may be due to substances that are not toxic and which don't elicit an immunological reaction, but which nonetheless cause symptoms. These reactions are called food sensitivities or intolerances, and it can be hard to differentiate them from food allergies. Often they occur to food ingredients that your pet has never been exposed to, and they most often occur immediately following ingestion of that food ingredient. Contact allergies come from direct exposure of the skin or mucous membranes to an allergenic substance. One example of this is flea allergy dermatitis, which is a hypersensitivity reaction the pet has to the proteins in flea saliva. Contact allergies can also be called contact hypersensitivity reactions. In areas that have fleas, flea allergies are more common than inhalant allergies. One term you may also hear or read about that is used commonly when discussing allergies is the term atopy. This term describes the genetic tendency of an animal to have allergic symptoms, and atopy refers specifically to the inhalant or environmental type of allergy. Now, here we see a photomicrograph of a lymphocyte surrounded by red blood cells. Lymphocytes are specialized white blood cells of the immune system. Allergic reactions occur when a special type of antibody called IgE is produced by a lymphocyte after it has been sensitized by an allergen. We don't understand yet why some substances will create an allergic response in one individual, but not create that allergic response in another individual. Individuals who respond with allergic symptoms to environmental allergens are genetically programmed to do so and are called atopic, and their allergy is termed atopic allergic dermatitis. Medical science has found that most allergies are genetically pre-programmed and that animals don't suddenly become allergic. Their allergies will manifest over time as continued re-exposure to the allergen triggers the allergy. Each new exposure to the allergen can create an increased and amplified allergic response. Some individuals have this hypersensitivity and intolerance for substances that are basically non-toxic to the body, like pollen. This sensitivity and intolerance results in the overreaction of the immune system that causes the development of symptoms of allergy. This immune system reaction will occur when an atopic individual encounters a substance to which it is sensitive or intolerant, and the development of symptoms involves the release of histamine and other substances from specialized immune cells that are called mast cells and basophils. But not all mast cells and basophils are involved in the allergic reaction. Many of them are, though. The allergic reaction works like this, and this is a great diagram. A specific allergen, say from beef protein, comes into contact with a specialized lymphocyte, which then produces the IgE antibody sensitized for beef. You can see this represented in the picture on the left of your slide. The sensitized IgE embeds itself onto the surface membrane of the mast cell. This IgE that has been sensitized to beef protein will become activated when the specific allergen that it was sensitized to, in this case beef protein, comes into contact with it. And each time it comes into contact with the IgE, because it has already been sensitized, the allergic reaction, the allergic response can worsen. When the allergen contacts the IgE molecule on the mast cell, a cascade of events occur, which you can see in the picture on the right of your slide. And these events finally result in the release of histamine and other bioactive molecules that are contained in the mast cell. The histamine and other bioactive molecules are stored in little sacs known as vacuoles in the mast cell cytoplasm. The release of histamine into the local area around the sensitized mast cell results in what we see as the allergic reaction. The histamine and other histamine is responsible for creating the actual symptoms of allergies. This is why antihistamines can be very useful in treating the symptoms of allergies. Mast cells and basophils are unique in the body in that they contain these histamine vacuoles. A human being with allergies most commonly will have hay fever symptoms of watery eyes, runny nose, and sneezing, or they may even have asthmatic symptoms of coughing and wheezing. These are the symptoms of an inhalant allergy in people. Dogs and cats can also have respiratory symptoms, but more commonly they manifest symptoms of allergies on their skin and hair coat. This is because there is a difference between the anatomical location of the mast cells in dogs and cats versus that location in human beings. The mast cells in humans are primarily located in the respiratory tract, the nose, sinuses, airways, and lungs, whereas in dogs and cats, most of the mast cells are located primarily in the skin. Dogs and cats do have some mast cells in the respiratory tract, so that is why they can sometimes have sneezing or tearing eyes as symptoms of allergies. And humans do have mast cells in their skin, which is why some humans can also have allergic or atopic dermatitis. So you and your dog may both have hay fever, but you will be mostly sneezing, and your dog will be mostly scratching. Each of the three different types of allergies requires a different approach. Your pet may only have one of these types of allergies, or they may have two or all three different types of allergies all at the same time. For instance, with contact allergies, identifying the allergen and avoiding it is the best approach. Flea allergy dermatitis is a type of contact allergy. Usually, topical treatments and avoidance work the best for contact allergies. But with flea allergy dermatitis, which can be particularly severe and difficult to treat, we often have to use oral treatments as well. With flea allergies, treating this type of allergy means you need to make sure you have flea control in your environment and on your pet, in addition to treating the allergy symptoms. These days, there are many non-toxic choices for flea control, both on and off of your pet, and they all work pretty well. If your pet has inhalant allergies, it can be pretty difficult to avoid trees and weeds and flowers, or indoor allergens like dust or dust mites. You can cut the cedar trees down in your own yard, but what about when the wind blows pollen from your neighbor's cedar tree into your yard? You can't cut your neighbor's trees down. For inhalant allergies, I recommend immunotherapy or allergy shock. The serum for these injections is derived from intradermal skin testing, or can also be derived from a blood test. In my own companion animal practice of over 30 years, I have found that by combining this immunotherapy with certain dietary supplements, with healthy and wholesome diets, and with antihistamines, I am able to bring comfort and relief to the majority of my patients with inhalant allergies. Giving immunotherapy by injection is the conventional standard of care for inhalant allergic patients. Next slide. Food-based allergies can be controlled and managed very well through diet and with certain dietary supplements. For a food allergic pet, if you don't feed them the food ingredients that they are sensitive to, they will not have any symptoms of allergy. As a veterinarian, I am always happy to find that an allergic patient has food allergies but doesn't have contact or inhalant allergies. This is because I know that most of these patients can be treated very successfully. We can have total control over what foods our pets eat, since we buy them their food and we serve them their meals. The key to successfully treating dogs and cats with food allergies is identifying the foods they are allergic to and avoiding those in their daily meals and treats. Okay, so the big question is, how do you know if your pet has food allergies? The signs of food allergy in dogs can be similar to those of inhalant or contact allergies. Each food allergic pets will be scratching and chewing and biting, just as the inhalant and contact allergic pets. However, with food allergies, we commonly see specific anatomical locations more affected than in the inhalant or contact allergic pets. These locations include the ears, the anal glands and rectum, and between the toes. Food allergic pets can develop ear infections that are characterized by a dark, thick goo that fills up the ear canal. These are the pets that are always scooting and need to have their anal sacs emptied quite frequently. But, in my 30 years of experience as a veterinarian, I believe a healthy pet should never need to have its anal sacs emptied, ever, if it's healthy. These are also the pets that are constantly chewing between their toes and have developed red inflammation that is usually moist and oozing and can be quite sore to your pet. Many food allergic pets will also have gastrointestinal symptoms secondary to their food allergies. This may mean vomiting, diarrhea, soft stools, or burping and passing gas, or may even manifest as a poor appetite. Eating the food might give them a tummy ache, and even if it doesn't cause frank symptoms like vomiting, it might reduce their appetite. Your pets with allergies will often have bacterial staph infections, usually on their tummy and in their armpits and groin areas. Staph infections usually look like rashes with small red raised bumps that are often extremely itchy. Pets will self-traumatize themselves with these staph infections that are termed pyoderma. Often, with food allergies, areas of the skin can become excessively moist and or oily. They can weep serum and develop a foul, sickly, sweet, sour odor. This odor is due to a condition we often find with allergies called seborrhea. Seborrhea makes the skin feel oily, and it is caused by unhealthy skin that is beset by allergies, causing it to secrete a thicker oil. Skin oil is known as sebum, which is where the term seborrhea is derived. The growth of pathogenic organisms in the skin also will feed on this oil and ferment it, resulting in that yucky smell. The byproduct of this bacterial fermentation will increase the itchiness and inflammation of the already unhealthy skin of the allergic pet. In pets, it's usually the Staphylococcus bacterium that is the opportunistic infective agent secondary to food allergies. Pets with food allergies can also get an overgrowth of a yeast that normally inhabits the skin of healthy animals. When the immune system of the skin is not working up to speed, a yeast called Malassezia flourishes and begins to cause symptoms of skin inflammation, itching, weeping of serum, and in some cases, hair loss. Other opportunistic pathogens, such as the skin mite, Demodex, or even the scabies mite, can also create infestations secondary to the disruption of the skin's normal immune system in pets with allergies. In humans, a different type of opportunistic yeast infection will become active with food allergies. This is the yeast Candida albicans. This yeast is also present in healthy dogs and cats in small numbers. The Candida yeast can also become a pathogen in dogs and cats, but it is not generally associated with food allergy as it is in people. It is the Staphylococcus and the Malassezia infections that are the opportunistic invaders we see in dogs and cats with food allergies. Now, we've seen how true allergies manifest themselves physically in pets, but what food ingredients are the common culprits? Pets can be sensitive to any food, but there are certain foods that have been found that pets are more likely to be allergic to. A study by the noted veterinary dermatologist Verlinden, published in 2006, analyzed 7 veterinary dermatology studies in dogs and 7 studies in cats in both Europe and the United States. These 14 studies in dogs and cats used elimination diets and individual ingredient challenges to determine to which food ingredients pets are more likely to be allergic. Elimination diet and individual ingredient challenges are currently the most accurate way to determine a food allergy. The combined 14 studies found in dogs, listing from the most common to the least common top 10 food allergens, that beef allergy was the most common allergenic food ingredient reported in 36% of the dogs in these studies. It's very interesting to note in this study, although not listed on the slide, that allergies to dry or canned foods were 6% and 8.6%, respectively, in this study. This is irrespective of whether the ingredients themselves were allergenic. Going back to the list, you can see that after beef, dairy comes in as the second most common food allergen determined from this study at 28%, followed behind that by wheat at 15% and egg at 10%. Chicken's not much different than egg, and I guess in this case, the egg came before the chicken. So in my own veterinary practice, having seen allergic patients for over 30 years, I found that some dogs and cats can be sensitive to the actual kibble or the canned food and not to the ingredients in the food. And so this is why when I would advise a pet guardian to try feeding their pet something different than kibble or canned, like Nature's Variety Instinct Raw, I would often find that their allergies improve. This allergenic sensitivity to kibble or canned food, regardless of the ingredients they contain, is one very important and scientific reason why the feeding of raw diets may significantly help your pets with food allergy problems. Now, the Verlinden study that I mentioned in the previous slide found that cats are even more sensitive to the allergenic effects of dry and canned food at 24.8% versus dogs at 14.6%. You could also see that it was determined that 2.2% of cats were actually allergic to the food additives that are used in the manufacturing process as preservatives. But you know, not all pet foods contain these food additives either, so check your label. Both of those data from this study demonstrate that food-allergic cats are better off eating fresh, wholesome, unprocessed, and minimally preserved foods, such as the Nature's Variety Instinct Raw. The top three allergenic food ingredients after the category of canned and dry commercial foods starts with beef, as with dogs, at 20%, followed by dairy, as with dogs, but in this case 14.6%, and fish at 13%. Poultry, which includes chicken, was only 4.5%, and it was tied with barley and wheat. So according to this study, feeding rabbit, egg, and or lamb would be your best bet to food ingredient choices from this list to feed an allergic pet. In other veterinary studies, it has been found that 35 to 48% of dogs and 50% of cats will be allergic to more than one food component. It has also been found in a number of veterinary studies that in dogs with food allergies, you will have about a 10 to 15% incidence of concurrent GI symptoms with food allergies. It has been reported that cats will have as much as a 33% incidence of concurrent GI symptoms with food allergy symptoms. And in one study in food allergic cats, they found that 75% of cats with food allergies only showed GI symptoms. Cats are much more likely to show evidence of food allergies by having GI symptoms than dogs, and they may not even have skin problems. Cats can have different manifestations of food allergies, and these, which are different than dogs, can include rodent ulcers, asthma, and miliary dermatitis. Additionally, in certain groups of food, there can be some cross-reactivity, which can result in a variable degree of allergy for other members of the food group if one member is found to be allergenic. This is due to the antigenic similarity among food allergens of the same group. In pets, we see a cross-reactivity, in humans, we see a cross-reactivity with seafood, grains, and certain vegetables. In pets, this cross-reactivity has not been found to be true based on our existing testing methodology, but some veterinary dermatologists believe that there is some cross-reactivity among allergens of the same food group. It is also possible to see a cross-reactivity when an inhalant allergen, like pollen, for instance, is similar in structure to an ingested allergen, like, say, yeast. Of course, if a dog has inhalant allergies to grass and is also a grass eater, we can then see some food allergy symptoms from eating the grass, in addition to the inhalant allergy symptoms from breathing in the grass. It's not uncommon for dogs to have contact allergies to grass, which you might detect if your dog starts chewing its paws immediately following its walks outside. Often, if you rinse the dog's feet off with water and dry off with a towel before coming into the house, it can prevent that contact allergy to grass. Some pet guardians find that rinsing their entire pet off after it comes inside can also help with their environmental inhalant allergy. It has been found that some allergens can be absorbed through the skin. Food allergies in general, though, are very specific to the exact food ingredient allergen. What this means is that if your pet is allergic to chicken, it may not be allergic to turkey or to duck or other sources of poultry. So each individual animal has a very unique sense of sensitivities to a specific set of food allergens that are unique to your pet and probably different than your neighbor's pet. From all of this, you can see that it can be quite complicated to determine what foods to feed and what foods to avoid when feeding a food-allergic pet. Next slide. So let me now explain how we figure out a hypoallergenic food ingredient. Although the veterinary dermatology study I cited in the previous slide is considered the most recent and most accurate by veterinary dermatologists, it is lacking many of the newer food ingredients that are found in the modern pet food marketplace. Many of these novel ingredients have found their way into commercial pet foods specifically to create diets with ingredients that pets would not be allergic to. These are ingredients such as sweet potato, tapioca, potato, kangaroo, venison, duck, bison, and so on. The best testing method to determine food allergies, the elimination diet, and an individual ingredient challenge can take 2 to 4 months to determine if even a single food ingredient is allergenic. Testing for food allergies by a blood test has been found to not be as accurate as the elimination diet approach, but can be useful in helping to determine a starting point for the development of a hypoallergenic diet. Okay, so how do you do this? How do you help your faithful friend be less miserable? How do you find a diet or diets for your pets that won't foster your pet's allergies? One way is the most simple, but doesn't have a very high success rate. That is, using trial and error. You keep trying new diets in the hopes that you will find one that doesn't cause food allergy symptoms in your pet. By definition, a hypoallergenic diet does not contain any food ingredients that are allergic to an individual pet. And when you look at the information from the veterinary dermatology study regarding which food ingredients are allergenic, you can see that there is no single allergenic food material that all animals are sensitive to. In order to not feed your pet the food ingredients that it's sensitive to that it's allergic to, you need to find a diet that does not contain those ingredients. That is what a hypoallergenic diet would be for your pet. Unfortunately, if a pet has allergies to any foods at all, it can develop new allergies to new foods it is introduced to if it has been eating these new food ingredients long enough. This is one reason why we recommend rotating diets, especially in allergic pets, to keep them from becoming allergic to the new food ingredients. But if you rotate between diets that contain food ingredients allergenic for your pet, its allergic symptoms will worsen. You must rotate among truly hypoallergenic diets specific for your pet in order for diet rotation to work for an allergic animal. The period of time between diets can also be a variable factor, dependent upon how severe your pet's food allergies are. Some pets will become allergic to new food ingredients very quickly, often as soon as 3 to 6 weeks after starting the diet. Other pets can take longer, 3 to 6 months, or even as long as a year or more. Often the first hypoallergenic diet you feed your pet is called the sacrifice diet. You feed it until your pet becomes allergic to it. From that, you know the time interval for rotating hypoallergenic diets. The reason why the first diet you use to determine this must be sacrificed is because it can't be used again without precipitating food allergic symptoms in your pet. The accepted technique to find hypoallergenic food ingredients for your food allergic pets is the elimination diet followed by individual ingredient challenges. This is not an easy approach, but the reality is there is no easy approach to finding the best hypoallergenic diet for your food allergic pet. Studies have proven over and over again that this technique, although a bit unwieldy, works. So let's run through the technique step by step. You can see the steps on the slide. 1, record a diet history of all the foods that were fed in the past 12 months or since the dog became allergic. 2, find the ingredients that are available in other pet foods that are not on the list in number 1. Those are the hypoallergenic ingredients for your pet. Feed those ingredients for 2 months. Do not allow your pet to eat anything else. And introduce a new trial food ingredient after 8 weeks. Do this one at a time for a week each. Now, hopefully, the diet that you've been feeding for these 2 months is causing a reduction in the symptoms that you've seen of the food allergy. Otherwise, it still contains some allergenic ingredients in it. But when you add a new ingredient to this hypoallergenic diet, if you see reactions, then you know that new ingredient is a forbidden ingredient and you don't want to include it in your list of okay ingredients. But if you feed that ingredient and after a week or two you're not seeing an increase in symptoms, then you know you've got another hypoallergenic food ingredient. Okay, let's go to the next slide. That was a lot. So, as we've learned earlier in this webinar, the temperatures and pressures of food manufacturing can sometimes alter the food's molecular structure to make it more allergenic to some pets. For this reason, feeding raw diets that do not contain any allergenic ingredients can also often help a lot in reducing allergic symptoms in your pet. Similarly, if your pet has a sensitivity to grains, feeding it a grain-free diet may help substantially, as well as ensuring that the other ingredients in the pet food are also not allergenic to your pet. The best solutions for finding a hypoallergenic diet for your pet and to help with the trials and tribulations of the elimination diet is to use what are called limited ingredient diets. Limited ingredient diets are diets that are available in the pet food marketplace that have a single source of protein and a single source of carbohydrate. Like Instinct, limited ingredient diet that uses lamb or turkey as the protein source and tapioca as the starch source. Did you know that tapioca has not been known to cause any allergies in pets, but potatoes have? The limited ingredient diet is simple, and at most should contain only 2 allergens versus diets that contain multiple ingredients having the potential for allergies to multiple allergens. It is much more difficult to figure out what your pet is allergic to when you're feeding a diet with tons of possible allergens in it. If you can eliminate the foods that your pet is allergic to, its food allergy symptoms will go away. This can take some time unless you get lucky using the elimination diet. So it's important that your pet not be miserable for the many months it may take to get its diet issues figured out. Meanwhile, until you can figure out which food ingredients to feed, your pet suffers with itching, sores and rashes, hair loss, and infections. There are measures, though, you can take that will help your pet be more comfortable. You should ask your vet for help with this. Antihistamines can be really helpful. It's important, though, to use the right dose for your pet, and not all antihistamines work the same for your pet. Sometimes one won't work where another will. I recommend starting with Benadryl, and the generic works just fine for pets. Give your pet 1 milligram of Benadryl for each pound of body weight twice or even 3 times daily. Your pet will get over the drowsiness that the Benadryl can cause at first. Another good choice that may work when the Benadryl doesn't is generic Claritin or generic Zyrtec. These antihistamines are less likely to cause drowsiness and can even be used together or with the Benadryl. Give 5 milligrams twice daily if your pet weighs less than 30 pounds, and 10 milligrams twice daily if your pet weighs more. Natural remedies that can help your pet better manage its allergies include fish oil and probiotics. Good, solid research has established that both of these help to reduce inflammation from allergies. The fish oil at very high doses is an anti-inflammatory and also actually changes unhealthy immune system function and helps to normalize it. The dosage for fish oil is based on the content of one of its 2 major fatty acids, EPA. This is short for eicosapentaenoic acid. You want to give a minimum of 20 milligrams of EPA per pound of body weight of your pet daily. Be patient. Studies show it takes about 3 months to have its full effect. Probiotics are the beneficial bacteria that help our gut to stay healthy. They also have a very strong positive effect on the immune system. Studies in allergic children have found that giving them probiotics from birth on and giving them to their mother while she is pregnant can reduce allergies by as much as 50%. You can get probiotics that are specially for animals from your veterinarian. It's best to look for a multi-strain product and to give a pretty large dose of the beneficial bacteria from between 2 billion to 10 billion viable organisms mixed with their food daily. Wow. So we're nearly at the end of our time for this seminar, and it's been quite a bit of material that we've covered today. So let me summarize the important points that I've discussed with you today. 1, pets can have allergies to foods, to environmental causes, and to things they come into contact with, such as flea saliva or grass. Some pets' reactions to foods are not allergic, but are due to sensitivities or intolerances to the food. By eliminating the food ingredients that your pet is allergic to, you can put a stop to allergic symptoms. The best way to do that is with an elimination diet and individual food ingredient challenges, and limited ingredient diets can help here. Some pets may have multiple types of allergies at the same time. They could have allergies to foods, to environmental allergens, and even contact allergies. Pets with food allergies can often be helped with a raw or grain-free diet as long as they don't contain the ingredients that the animal is allergic to. So, Russ, so I want to thank you all for listening today. And Russ, do you want to take it?
Yep, thank you, Dr. Silver. And now it's time to answer some of the questions people have been sending in. Reading the questions on behalf of everybody who submitted one is Jill Gaynor from Nature's Variety. Okay, Jill, let's hear some questions.
Thanks, Russ, and thanks, Dr. Silver. We have quite a few questions. Hopefully a lot of them were answered by the webinar. But just to recap, how can you tell if it is a dog food allergy or a skin allergy?
Well, really, because dog food allergies manifest on the skin, it's really the same thing. A dog food allergy is a skin allergy, although it's hard to tell. The question might be referring to inhalant allergy. So using the guidelines that I mentioned before, food allergies as compared to inhalant allergies tend to have more of these rashes and moist areas of skin, problems with their ears, between their toes, and anal glands. And oftentimes you can see an association with feeding a food and an increase of these symptoms.
Great, thank you. What's the difference between a food allergy and a food intolerance?
Well, a food allergy really involves the immune system. And we describe the IgE and the mast cell and the histamine. A food intolerance is more that the animal has some sort of a chemical sensitivity to the food itself. There's something in the food, something about the food that the animal is reacting to, and it's not immunological. Usually with food intolerances, you'll see an immediate reaction when the first time that they ever eat this food ingredient. With food allergies, we don't usually get a reaction the first time, but with subsequent exposures, we do see the symptoms arise.
Thanks. Another participant wants to know if it's possible for a dog to develop an allergy to corn and dog food after 4 years of being on that same food.
It is. This is what I was describing a little earlier as far as the sacrifice diet, in that we feed a food ingredient that the animal's not sensitive to long enough until it becomes sensitive. In this case, it was 4 years. It took 4 years for the animal to become sensitive to that ingredient, corn, that it had not been sensitive to before.
Is there a certain age that dog food allergies will start to manifest, or can they happen at any age?
They can happen at any age. Usually they happen relatively early in the animal's life, and it has to do with them being exposed to the food and then re-exposed to the food. But I have seen some that out of nowhere, older animals suddenly develop a food allergy, and we don't understand why that happens.
Great. We've got some questions from Twitter, too.
Okay.
We had one person who has some pugs, and they wanted to know if his pug's tongue swelling has any possible trigger, like an allergy or a food sensitivity.
The pug's tongue swelling?
Yes.
I think that it's certainly possible. I would tend to think it might be more related to a contact allergy, though. Could be contact allergy to something in the food, or possibly to something that the pug is chewing on or putting into its mouth. That's a complicated problem. Hopefully they're seeking veterinary care.
Great, thank you. We had another person want to know if a dog ingests or eats a diet that has yeast in it, will that cause yeast infections?
It won't. It won't cause yeast infections, although it is a common misunderstanding. The yeast is digested by the enzymes and the stomach acid and is not alive, so it doesn't grow and go on to become a yeast infection. There are certain types of yeast that are actually used as probiotics, so it has to be a pathogenic yeast that's alive that they eat in order for it to cause an infection.
Great. We've got time for one more question, and one of our listeners wants to know, would all dogs benefit from grain-free or potato-free dog food, or is it only best for dogs with allergies to grain and potato?
Well, if the animal has allergies and has problems that are related to the grains or potatoes, then certainly feeding those diets will improve those allergic symptoms. But there's nothing wrong with feeding those diets to an animal who doesn't have allergic symptoms. Because they've been manufactured and formulated to be good quality, very nutritionally complete diets.
Great, thank you. That's all the time we have for questions, so I'm going to toss it back to Russ to announce today's winner.
Okay, yes, as promised, one webinar registrant has been chosen to receive a special prize, 12 coupons good for his or her choice of any Nature's Variety product. And that lucky winner is Norm Shrout from Albuquerque, New Mexico. Congratulations, Norm. The 12 Nature's Variety coupons will be mailed to you pronto. Okay, I'd like to thank everyone for listening today, and especially Dr. Robert Silver for sharing his insight and expertise regarding allergies in pet dogs and cats. Thanks, Dr. Silver.
Well, thank you, Russ. I hope this information can help all of those poor, suffering allergic pets out there.
All right, and if you missed any part of today's webinar, or if you want to listen to it again in its entirety, you'll be able to do so in 1 week by going to dogchannel.com/diets. Thanks again for listening, and this concludes the Nature's Variety Dog and Cat Allergies Demystified webinar.